My name is Terry Peterson. I'm the Director of Strategic Key Accounts and Special Projects for Essilor Instruments USA. And our topic today is going to be the diagnosis of ocular surface disease. So first and foremost, when we are concerned about dry eye disease, we need to understand the health of the Meibomian glands. The Meibomian glands are in the lower and upper lids, and we need to use a device called a meibographer to actually image these glands to determine how healthy or unhealthy they are. So the MeCheck here, made by Espansioni out of Italy, is a unique little device. You'll notice there's a pin in the bottom, and this pin could actually go into the pivot pin on a slit lamp that's in the doctor's office, so that could be used on their own slit lamp without a headrest assembly. But the way that it will come to you if you order it as a MeCheck kit is that the headrest assembly, the MeCheck capture device, which is a camera, and the pivot pin assembly will all be together. There's also another camera next to it. It's called a lash cam. And this is a near-infrared camera that allows us to actually take high-resolution pictures of the patient's lashes, so where we can look at incrustations on the lids called lid scruff, or demodex, which are the little bacteriological mites that create the inflammation in the eyelids. But most of what we're going to do in this session here is we're going to talk about the MeCheck camera, which is the imaging device for meibography itself. So let me place this back on the pivot pin here so that it's nice and tight. You can adjust the pad up or down to where it's more pleasant to you as far as its angle, and you're going to turn it on. So it's just like any tablet. We'll turn it on. It will tell me that I'm in a Espansioni group. One of the critical things is you need to check your battery power. So this is something that we've found that's quite evident, is that you need to have this charged. If it's not charged, it's going to take about 2 hours for the tablet to fully charge. The second thing that we found is that when you attach the tablet to the camera, so the camera is positioned in front of the patient, and then there's a cord that goes into the bottom of the tablet. The cord powers the camera. If the camera is on and the tablet is on and you're working during the day, it's drawing a small amount of amperage. And so if you don't turn the tablet off at night, or you don't recharge the tablet on a continuous basis, you could end up with a situation where you were in front of a patient and the tablet was basically out of juice. So most certainly, if you're not using the MeCheck for long periods of time, turn it off on the top. That way you're not running the battery out. To establish contact on the tablet, just push the button up on the top. It'll say Espansioni group. For us to get to our working page, you want to swipe up. When you swipe up, what it will do is it will tell you what Meibomian glands and dry eye screening is all about. This is a verbiage as to what we tell patients is going on during this procedure. If we have an existing patient, we'll type on existing patient. If the patient's coming in new today, we're going to hit new patient. What we're going to be doing right now is we're going to be talking about meibography. And what we get on the screen is we get this kind of red lips kind of look here. It's going to start with the right eye. There is a little black cap on the front of the camera, and if the camera doesn't show up and it's a new install, make sure to take that black button off. And we're going to get our lips. We're going to put our patient into the chin rest, head all the way up against the headrest. We're going to do the right eye first here. I will place the depressor under his lid, have him pull down and push in maybe a little bit. And what this did is it inverted his lower lid. From a technician standpoint, what we would like you to do is to try as much as possible to get the patient to help you do the lid retraction. You want to be under the eyelashes, not on the lashes themselves. You're going to want to be right under the eyelashes, pull down, and invert the lid. We're going to have him pull his lid down. I'm going to lower the lips there on top of his glands, just like yay, touching the bottom gland and the top gland, and hit save and proceed. So all you as a technician have to do is move in or move out to get that picture the best that you can, and make the top portion of the lip at the furthest distal portion of the glands, and the lower portion of the lips right at the lid margin. To improve our picture, what we will do is we'll move our brightness down a skosh. We'll move our contrast up a bit. It looks to me like I've moved my brightness down too much, like that. The instrument then can see all of these glands, and in this case we have a medium measurement. So sometimes we could get low, sometimes we get medium, sometimes we can get high. What's really more important is the picture impressionally good enough for the instrument to make a decision? It finds him to be a level 2. I'm going to hit save and confirm. Once that's done, we'll pull the joystick back, move it all the way over to the left eye, patient's back in the chin rest. They're going to put the depressor underneath the lid, and in this case, nice inversion on his part. Sometimes you have to actually get it to where you say, I want you to hold it right there, don't move it. And so what I did is I moved it to where I got the placement the way I liked it and hit save and proceed. So when you're looking at the glands themselves, you want the lid to be down and you want it to invert. And you should be able to, just with your physical eye, look and see these glands, these white glands that move up and down. They're side by side and they're vertical. And if you can see those impressionistically, you should be able to get a good picture here. If they pull down excessively, you get more of the fat that's way back in the lid. That's not where the glands are, okay? Or if you don't push in sometimes enough, you don't get enough inversion for the lids to be able to be in focus. And so sometimes this takes a little bit of practice. Sometimes you get it right away. Sometimes you have to take a couple of different placements to get them. But overall, it's a pretty simple thing to do. I've done thousands of these with technicians, and everybody kind of gets it pretty fast. So we're going to move the brightness down again a little bit, because it always is a little bit brighter than it needs to be. Move the contrast up. Get really nice contrast of all of his glands here. The instrument in this case got a high measurement. I can see the glands clearly. The instrument calls him a degree 2 as far as his disruption of his glands. We would hit save and proceed. This is something that the doctor could have either done with the patient before they got to the instrument, but if they did not collect what we call an OSDI score, an ocular surface disease index score, what this is this is the subjective state of the patient in relation to their complaint about dry eye. We're looking to see at what level does the itchy, scratchy, dry, visual dysfunction, problems with night vision compromise their daily routines. And a 6-question OSDI score is incorporated into the unit, and their questions will be as follows. Josh, have you experienced any of the following in a typical day during the last month? And the question is, eye sensitive to light, and your answers would be constantly, mostly, often, sometimes, or never.
Never.
Never is his answer. Blurred vision. Any sensitivity there? Constantly, mostly, often, sometimes, or never?
Sometimes.
Sometimes. So we'll mark that and we'll hit save and next. Then the next question is, have problems with your eyes limited you performing any of the following during a typical day in the last month? Driving or being driven at night?
Never.
Never. Watching TV or a similar task, and I want you to think about this being in front of your iPhone or your tablet or a PDA of any type?
Sometimes.
Sometimes. So we're going to save that. Have your eyes felt uncomfortable in any of the following situations or conditions during a typical day in the last month? Windy conditions?
Sometimes.
Sometimes. Or places of low humidity?
Never.
Never. Okay, those are our 6 questions. We hit save and proceed. In this case, Josh comes out with a pretty low OSDI score, kind of down in the 0 range. So this tells us his subjective situation is normal. He doesn't have any really classic complaints of dry eye, yet when we did the meibography, he's not perfectly normal. He's not a 0 or a 1, he's a 2. He has a subtle amount of meibography dropout or cellular dropout at his particular age. So once we've collected the meibography and we've collected the OSDI score, now what we can do is we can incorporate this into a patient's record. So if we hit save and continue, this allows us either to create a new patient record if he's new, or if he had been an existing patient, his demographics would already be here, and we would hit save and continue. And then right now where it says error saving data, we don't have an internet connection to this tablet at this point, to an EMR, but if the tablet was connected to the electronic medical record via Bluetooth, all the data, the demographic data that was just placed into the instrument, the meibography pictures that we took on the patient, and the OSDI scores could be dropped into the patient's medical record. It's also saved on the iPad where we can get back to it at any given time. The beauty of this is that the instrument will look at that whole area that I've imaged, and it will do an analysis from the nasal component to the temporal component, and it will tell us what the level of glandular function is, or actually how well they look, because there's AI built into this. You can do meibography in a lot of different ways. We're not an exclusive meibographer, but the one thing that is exclusive to this technology or this particular product is that the instrument will look at the glands and it will give us a rating of how degraded or how dysfunctional they are. The advantage of the AI is that I can take the technician completely out of the assessment, and the doctor doesn't necessarily need to be in the room to make the assessment as to the health of the glands.